and the School of Medicine, and Derek DeLauro from the Mastery School of Hawken, and we're going to hear about the important topic of introducing high school students to public health.
Thank you. I want to change gears and bring us back locally here and talking about engaging our high school students in local public health. We have no disclosures. Some of the learning objectives that we had today was, one, we just wanted to share with you what our program looked like. We've been doing it for a couple of years now, and it's been evolving since we started it. But just some of the key components that we've implemented, some of the strategies that we think work, and the lessons that we've learned on the way. Hopefully we can help you use this model to do things locally where you are, and then customize it based on what your context might be, and what public health agencies you have. So the background of this, initially we noticed that public health has historically been underrepresented in high school curricula. I am not always quite sure what is taught in high schools prior. And then COVID-19 really demonstrated the need for public health literacy and community engagement with the disparities that we are seeing. Youth are often recipients of a lot of public health initiatives, but are rarely involved in the development of these initiatives. And as you can see, social media and all sorts of avenues of information sharing are out there now, and I do not have the tools to manage those. So to address the gap, our objective was to immerse high school students in real-world public health challenges and to empower students to research and develop evidence-based community interventions.
So I'm going to talk a little bit about the actual school that we work at. So this was not implemented by the Board of Health to a school. This was the school that I work at, the Mastery School of Hawken, reaching out to the local Board of Health, but it could really go in either direction. But you need a little bit of context around the school because it is not a traditional high school. So Hawken is one of the largest private schools in Ohio, and they opened in 2020 an experimental campus in the heart of Cleveland to try to work in engaging students in real-world problem solving with actual community partners. I'm one of the founding faculty. I wasn't there in 2020, but I came soon after. The thing that we do at the Mastery School that's a little bit different is that we work on these things called challenges. That's kind of the core of our entire curriculum. And we engage with external partners. And rather than having students learn skills and content and then go do complex problem solving, we put them into a challenge, a real challenge that they're engaging with that has real stakes. And in the process of that, as we'll kind of talk about here, the students learn a tremendous amount of skills and content in whatever area they're engaging in. And these challenges typically last 3 to 6 weeks, depending on the context of it. And they generally end with a presentation of a proposal to an external community partner. I'm going to go into some of the details that I can. It's 25 minutes is not a lot of time. But if you are interested in following up and finding out more specifics, we do a lot of educator visits. We bring people in all the time. You can reach out to myself or the school directly, and we'll figure out a way to get you to see some of the more specifics of what we do. Our core classes that we do this problem solving in, we refer to as macros. And this is where things get a little bit different than a traditional high school experience. Macros are project-based classes where students spend 2 to 4 hours a day with the same teacher working on these challenges. So I teach 20 students. It's the same group. It's like being an elementary school teacher with much higher level skills that we're engaging with. But I'm working with those same students. If I was to teach AP biology, I would get maybe 3 or 4 hours of contact time a week with a student. In this kind of structure, I get about 12 hours a week with the same students to work on really complex things. So this is an incredibly beneficial model for engaging with this kind of real world problem solving. And also crucial is that students work in teams. So this is not an individual experience. Much like we heard about in the previous presentation, collaboration is a huge part of the process, as we all experience in any kind of problem solving, especially in public health. So the teams will get together and work in ways that I'll describe in a little bit. But these teams ultimately are the people that present as a group to the partners at the end of some kind of challenge. And we presented to the Board of Health at the end of about a 4-week stretch. So just some context, and then Dr. Ganesh will hop in for a little more about it. We have a launch where we have a partner come and talk to the students about a problem they're having, and the students have no context for this. So I don't give them 2 weeks of lectures and preparation. They get given a challenge that is well outside of their range of capability, with the knowledge that they will be supported in getting to that capability as the weeks progress in time for them to give that challenge. And Dr. Ganesh can talk about the actual language he presented to them for their challenge.
Yeah, I also didn't know that I was walking into them not knowing anything about what was happening. But just to describe the challenge language, so Mr. DeLauro and I are speaking prior to this, and I give them ideas of what could come around or what could be of interest. And then once we land on kind of a subject area, this public health challenge this past year was HIV, but the previous year was on tobacco and youth. And so the language that I do develop is working from my clinical practice, what I'm seeing in clinic, where I do a lot of HIV care, but also with our public health colleagues. As medical director of the county, I get to interact with our Ryan White teams and other agencies working on ending the HIV epidemic and other programming. And so a lot of the challenge that I develop or bounce between Mr. DeLauro and I end up being discussed a lot about between the HIV teams and the health department too. So this was the language that we used, and we try to target specifically the youth age group. So this one was looking at implementing evidence-based strategies to identify and engage youth living with HIV who are currently out of care, and then they need to be effectively connected to comprehensive healthcare services such as those available through Ryan White HIV/AIDS programming. And a lot of of us don't know about HIV programming or Ryan White specifically, so we go into a little bit of that too.
So this launch happened on the second day of the semester, so the students had very little context. But once they were given this challenge, this is the timeline that I'm going to go through and kind of break down piece by piece for what we did. We had about 4 weeks, and we covered a wide variety of topics and things. This is the advantage of having 12 hours a week with the same group of students. The first thing I'm going to talk about is one that we read a novel, essentially, which normally would be something that's more of a high school requirement, but in this case was a deeply important part of their public health education. There's this fantastic novel from 2018 called The Great Believers, which is about a group of male friends navigating the HIV pandemic in Chicago in the mid-'80s, and then follows through to the kind of aftermath of it. It's an incredibly beautiful novel. If you haven't read it, it is wonderful. I would definitely check it out. But this anchored for them a sense of a sort of personal story, which for adolescents is incredibly important for understanding what the actual stakes are that they were navigating. Adolescents can get really deep into abstracting away the reality of a public health problem or any problem, and I wanted to give them something that felt personal so that they, through this process, were not simply relying on a kind of calculation of numbers, but were understanding that there are real human beings at the end of whatever intervention they come up with. So we read the novel throughout, and it was important for the first couple weeks that we talk about some history and some biology, of course. To give some context about the HIV history, I had a few basic things. One was there's a podcast series called Fiasco. They have a season about the HIV pandemic. It is a quick and efficient way that I was able to get them to navigate and engage with the topics of this. When I talked to Dr. Ganesh, as well as some of the other people that I ended up working with in this challenge, a lot of people echoed being shocked at how little the young people they talked to knew about the history of the pandemic. And I heard from multiple people this quote that they'd hear of, "Oh, I just have to take a pill, that's it. It's not a big deal, I don't need to worry, there aren't these big stakes for me, because it's just a pill and then that's what I do for the rest of my life, and that's fine." And so I felt it was incredibly important to understand the actual context of what has happened before in America around HIV/AIDS. And peppering in with that, I pulled excerpts from And the Band Played On, the seminal work from Randy Shilts. We didn't read the entire book because it is very long and fairly explicit for high schoolers at times, but there were some really, really good segments that we were able to pull to give almost like a primary source. For those of you who don't know, Randy Schultz was a journalist in San Francisco at the time who ended up unfortunately passing away from HIV/AIDS, I believe in 1990. We also watched the documentary How to Survive a Plague from, I think, 2013, which is all about ACT UP and the protest movement around patient rights with HIV/AIDS. And in this process, the students were, my kind of secret goal for them was that they were actually learning about what public health is. Rather than me getting up and defining terms or trying to describe things, they were actually seeing the complexities of political, social, cultural, and scientific interfaces coming together to produce specific health outcomes. And we had debates in the class about whether they should have closed the bathhouses in San Francisco in the 80s and whether people should have been getting tested before there was a cure. And we talked at length about the tactics that ACT UP used and whether they worked and whether, how they could be applied to things like COVID and stuff like that that's happening in current day. But if I had just given this history course without context, then I would have been relying on the students to have some sort of interest intrinsically in this topic. For all of the students, they became deeply invested because they understood that this was part of the challenge that they needed to know about to talk to the Board of Health. So it created this sense of stakes that pulled everyone in really deeply to this topic. So I'm not going to cover the biology side because that was mainly just a few lectures that helped give some context. Mostly the students discovered all of that on their own through their own research. But the thing that we did that was really important is we had a series of visits that I'm going to kind of describe one at a time to either places or experts that were really helpful to talk with. So our first visit at the end of the first week was to the LGBT Community Center. If you don't know, I believe that Cleveland has the third oldest LGBT center in the country, and an incredibly deep and rich history of HIV/AIDS activism. And we came to talk to them about not only the current things that they are doing with popular opinion leaders, but also to find out about the history of HIV in Cleveland. We talked to several people who were called Rainbow Pioneers, who were able to describe the actual lived experience of being someone with HIV in Cleveland at the time and continuing to live with HIV as an older person in Cleveland. The week after, we went down to CSU, Cleveland State University, which is in the heart of Cleveland, and literally just found a series of tables in the student center, and everyone went out to talk to students who were in the age range we were interested in, but also to the medical center there and any organizations that were around to try to get perspective of what it actually is like to be a young person, what they knew and understood about STIs and HIV in general, and to try to get a sense of what might be interventions that would be effective to people in this age range. And finally, we were visited by the Metro Health PrEP Ambassador team. This is one of their extremely appealing advertisements that they've put together for young people. We had a couple of PrEP ambassadors come down from Metro Health and talk to us about what PrEP was, what strategies and tactics they use, and also some of the ins and outs of the actual healthcare infrastructure around HIV positive people. They were people who talked to a lot of young people who are diagnosed immediately after getting diagnosed. And so it was really helpful to get some perspective of what the actual approach is to talking to people in this age group who are just finding out that they will be living with HIV/AIDS through their life. So all of this comes together with this big red block called Team Time, which, as you can see, kind of expands and becomes the majority of our time throughout the course of the 4 weeks. And Team Time is just a kind of a fancy way of describing the process that they all do together in their teams to try to figure out what their unique solution is going to be to a problem. So zooming in on this, Team Time is what I would call a semi-structured time to work with their teams on research and development. The semi-structure is, again, some of the specifics that you can come and visit us to find out a little more about. But suffice it to say that there is a lot of time where they are being given tools, but they are ultimately engaging with each other to try to figure out what they believe is going to be an intervention that will be effective. And I am a resource. I am there to give them perspective. I walk around, I talk to them, I ask them questions, but ultimately they are engaging together and they don't view me as the person with the answers because I tell them outright, I don't know. If this was something that was known, then we wouldn't need to be doing this as a challenge. So I don't hold the answers, I don't have a magic key, but I can help provide them with feedback and information that will help them figure out where they might go next, or who they might be able to talk to, or help them navigate a specific question they're trying to understand. And in this process, they're engaging in solution development. We have a bunch of whiteboards around the school, and they're always filled with notes the students get up and start jotting down. This was for a different challenge we did with a different organization around SNAP education. And the one on the right is an actual diagram that they drew to try to redesign a grocery store. They would then go on to implement this in a grocery store in a neighborhood in Cleveland to put healthier options at a more viable location in the grocery store. So they're trying to navigate an actual problem, and they're doing it through a real process. And it's not just go, we don't just send them out for 3-4 weeks and then hope it kind of comes together. We have things that we call share-outs, where they get up and actually have a progress check with me. It's usually about 3 times per challenge, so once a week or so. We have a formal time where they sit down and they actually go through their progress, what their research is, the things they've been discovering, their initial ideas for solution directions that they might have, and some kind of like questions that they're trying to figure out and navigate. And then I, as the teacher, get a chance to give them feedback and push them a little bit in certain directions, or to kind of question some of their assumptions that they might be developing. And we were very lucky to have Dr. Ganesh attend the second share out basically right in the middle of his process. You can talk a little bit about what that was like from his perspective.
I'll be brief, but I mean, it's just a way to kind of calibrate kind of where they're going, see where they are in terms of their thought process, what I know would be effective for the health department to hear, but also to make sure that they're evaluating. Usually they're pretty early on in their project, so kind of what I want to hear about is how they're going to evaluate that their program is effective, but also how is it going to be sustainable. So those are kind of things that I bring in, but most of their ideas are amazing.
So again, bringing this all together, this is this kind of timeline that I followed of starting with a little bit of time together in teams, but giving a ton of background and context once they actually knew what they needed to talk about, and then slowly pulling that aside, taking away the more structured homework assignments and the more structured discussions and lectures, and giving them more time to actually process and try to navigate this public health challenge that they were trying to figure out. And this culminated in presentations. This is us at the Cuyahoga County Board of Health presenting to their entire 25-person HIV care team. And they included proposals from the students such as organizing and expanding existing clinical mobile units. I'll talk about this more in a second, but this was a really, really interesting idea. They also talked about creating peer education programs to promote in-school usage of medical testing. One group essentially called a school nurse and discovered that basically every school in the CMSD, in the Cleveland Metro School District, has a partnership with Metro Health to get free and confidential testing should a student request it, confidential from everyone in their lives. But students didn't know about this. And they called roughly 20 schools and school nurses and did interviews with students and figured out that if there was a peer-based education system, they would probably have a skyrocket in testing rates in these schools. Another group talked about expanding and redesigning existing social media campaigns, and actually went out and did an experiment where they took pamphlets that they'd created based on literature they'd seen from the Board of Health and placed them in places like libraries and coffee shops and colleges, and then compared them with things that they had put up on people's social media stories, and were able to show that social media was a more effective way of getting them to follow links to HIV testing and care by documenting how many people were following links in different places. And finally, one group found this education video game company out at Yale that had come out of a lab at Yale that talked about education for STI and HIV, and they were able to show that this could be a more accessible sexual health education route in schools. They actually reached out to the company. The company was like, we would love to work with the Board of Health or any schools. So they offered this potential partnership. One of the students from this group is now going to continue with a summer internship with that company. So it opened up a pathway for that student, but also a possible partnership that could exist for the Board of Health. And to kind of highlight one that I know that Dr. Ganesh mentioned multiple times was really striking, is that this is an actual slide from the first group that I talked about. This group went out and started calling people to try to get a sense of, well, what is the needle exchange that's happening in Cleveland? They discovered that there are many mobile units, medical mobile units that are around Cleveland, and that there are 3 primary organizations that put these mobile units on, but they couldn't find where they were. They wanted to go talk to them. They didn't know where the mobile units were. They didn't know when they would be anywhere. And as they finally got in contact with the organizations were like, well, yeah, we don't talk to each other. We don't coordinate. And we would love help doing that. And so this group was able to talk to these 3 organizations. All 3 of them said they would love help coordinating with the Cuyahoga County Board of Health when and where they could do their mobile health testing and syringe exchange programs. And then they created this mock calendar to show what this could look like, as in either an in-person calendar or something that could go up on a website, as something that could get a sense of when and where different mobile units would be available. And Dr. Anish can talk about the kind of reception of that.
Yeah, we were all kind of blown away at how simple this was. All of the health department folks were looking at each other and like, why don't we have this already? It's free, it could be easily implemented. Why aren't we doing this already? And most of them are sub-grantees of us anyway. And so we're providing them funding for the needle exchange programming they're doing, but we don't know where they're going at what time.
And these next few things just got the 5-minute warning, so these next few things will probably move a little bit quicker. But I did, as a series of universal takeaways, and maybe we'll save the data that we gathered from that if people have questions about it. But the big takeaways were the challenge must be high importance and appropriately difficult. The partner needs to be engaged and available, right? It is not something that should feel easy to them. They should feel that they're going to have to do a lot of work, but that work is possible. And having Dr. Ganesh and the Board of Health be excited and engaged was incredibly important for this process. Students need a lot of semi-structured work time to work with their team to come up with their solutions. They need to be able to talk to people about the challenge, like experts, community members, and leaders. They need historical, social, and biological context for the challenge. And they need regular touch points with the teacher, both structured and informal, and the teachers need to provide clear feedback and treat it as a real experience with real outcomes. I would tell them all the time, you have the opportunity to actually change how public health occurs in the county. This is a thing that is real, and you might, and we can try to talk maybe at some point about how that might yield and change things that are going to happen. But it's important that they feel a sense of actual stakes with this. And I think we have more things, but I think we need time to give you guys a chance to ask questions. So we might be able to answer them if they come up. Does anyone have any questions?
Hi, great. Hello, great project. I don't know if you can hear what I'm talking about. Teresa Green from University of Rochester. So we have similar relationships with our high school students, and I'm actually going to talk to them about doing something like this. But on the project and the report out, do you give them a template, or are there parameters? Like, do they have to do a budget? Do they have to think about evaluation? Is it possible? That kind of thing.
Yeah, at this point in the school, they're used to working with a lot of organizations, so they actually often ask and seek out a budget so that they can create their own sense of scale. But I think some people shy away from giving specific numbers, but it's actually, I think, really helpful that they do get a budget because it helps them calibrate, right? Do they have millions of dollars? Can they build a new wing of someplace? Or is this something where they're, in this case, they have about $25,000, so I have to be really efficient with their funding. So generally, we try to give them a budget to make sure that they have a sense of how big their scope can be, otherwise they don't know how to calibrate because they have no experience in this field.
Agreed. And the evaluation point, because I know you asked about, are you measuring? Do they have to say measure of success or anything like that?
Yeah, usually they report that out when they give their presentation.
Perfect. Thanks.
Teresa Bird. That was awesome. And I'm not sure if we can do something similar in Texas with high schools. It's kind of tough. But it kind of made me think that perhaps undergrads could benefit from something similar. And it also made me think, you guys are making me think about some cool ideas, that since our MPH students are required to do an applied practice experience, having public health students run this with undergrads would be kind of awesome. So I want to just thank you, because I'm going to take that back to my faculty and say, maybe we can do this. But I think it's really awesome. I will tell you, in Texas, we would have never been able to do that particular case. We don't talk about that.
Yes, and I will just say that one advantage of working at a private school right now in this way that I never expected to be an advantage is that we aren't under the state laws of Ohio, which would greatly restrict our ability to give sexual health education.
Right.
So with the right school partnership, you might be able to find something that works.
Hello, my name is Opie. I'm from Cleveland, Ohio. I'm the mother of a senior who is about to go into school, into college for her undergraduate public health, pre-med track. And her interest in public health was not sparked because of me. It was because of a field trip she went to from school in a club called the Service Emergence. They went to Ohio City and they were with the homeless for like 3 days. They took away all their phones and that was all they saw. And also she's part of the local food pantry that we have. So she was exposed to food insecurities. But my question now is to the medical director of the county. My question is, Hawkins is a private school. Have you thought of, is there a way to collaborate with the public schools? Is that the next generation? Is there something that can be done to create?
I mean,
this
that
awareness?
was kind of one of the things that we are talking about now is how do we partner with other schools? One of the things that we have here is how do we expand this and create like a subcommittee that can inform like youth groups that can inform programming. What Mr. DeLauro was getting at in terms of various schools, like some of the public schools, sometimes we have a lot of difficulty getting involved in their curriculum. We have to go through their school board, and it becomes a very, it's a difficult landscape with the school board, the superintendents. But there's certain areas that we could, I think. I think CMSD is probably, or Cleveland Municipal School District is a good area that we would like to expand into and do this kind of work. Because it is very gratifying being able to teach the youth about public health. But
Thank you for sharing that. I personally will go to my own school board and talk about it.
thank you. No, I appreciate it.
Can you talk about the makeup of the ages of the students in the class? I don't think I heard that in the presentation. Like, what is that age range? Because it looks like, because it is a private school, and I know that oftentimes that there's a mixture of classes as far as like if the students are freshmen, a sophomore, junior, senior, or how that is for your school that you are at. Because I do work like this, but I do it internationally, and I think this would be a great program that I could take to the schools that I work with in another country, but also how I can sort of scale this to work with some of my undergraduate students and my master's students as I work in the community. But what is the sort of makeup of the students in the classes that you do this with?
This class in particular is an upper class only class, so it's juniors and seniors. So this class is 16 through 18-year-olds, and we have to calibrate things a little bit differently for freshman and sophomore classes that happen. But in terms of the makeup broadly, I should have mentioned this also. When Hawken opened a school in the middle of Cleveland, they dedicated a much larger amount of money to making sure there was a high percentage of Cleveland students who actually could go to that school. So this is, in basically any measure that you could describe, this is the most diverse private school I've ever worked at or seen. And many of the students who are in the class, I think a majority of them are from Cleveland and are from neighborhoods that we then work with and want to engage with these topics as topics that affect them too personally. So that I think is also crucial, is that the people who do this need to feel a sense of investment in that they live in the places that these are happening and they have a sense that this could influence them as well. But I think 16 through 18 is an age range that is more than developmentally ready to engage with these deep challenges, as long as they feel like there is a sense of stakes and that they're being supported in how challenging it is.
And I want to say that I think you should also maybe, if you could, offer extra credit if they watched the movie and the band played on.
Oh, that's awesome.
Because I think that would be great too, because I do make my Master of Public Health students watch it, and as old as it still is a very relevant movie, and sort of thinking about, again, public health history as well, especially in the early scenes of it with the Ebola outbreak and how we had that in New York or something like that a couple of years ago. So I think that'd be something to help us as we think about the next generation of public health professionals. So kudos to you guys for this as well, and so thank you so much for your presentation.
Thank you.
I just wanted to say on the public health side, the students presenting to us, it was really reinvigorating. Our entire team was excited about all the interventions they planned, and they were like, how can we follow up with them? How can we meet up with the teacher and discuss future plans? And we have a presentation coming up to our Ending the HIV Epidemic community advisory group in the spring, so it's over their spring break, and the students want to come and still speak at that. So that's happening in a few weeks here. But I teach at the med school and at the MPH program and have a course in the MPH program, and by far the students in the high school have been incredible. And so I'm considering giving this same challenge to my master's in public health school students now.
Yeah.
See how they do. But thank you.
All right, thank you. Let's give them applause. So the next session start at 10:40, so you have a little break here. Thanks for coming.
Yeah.
It's probably one of the most fun things I've talked to them do.
Like you said, it's reinvigorating.
I have a quick question. How can I get resources to take to the public, to my school, if I want to go to the board meeting to support what I'm going to talk about? But can I contact you then you give me
Let
your
me
email?
give you mine. I'll give you mine.
Because this is excellent.
Thank you.
It is excellent, yeah.
Yeah, well, I honestly kind of think that you want to teach could be allowed to.
I hope you have
I
enough.
think for undergrads, that would be
I have various.
You have lots of different
I
kinds.
am. Let me go stop that. I wanted to get
Even
myself.
for high
Pick your
schoolers,
time.
this is excellent. My daughter went on that trip and she was never there.